picture this. You're studying to be a registered nurse. A pandemic is declared in your third year of nursing, meaning that your last year of school will all be online. Surely, the virtual simulations will prepare you to enter practice. You graduate, excited to enter the profession of nursing. You show up for your last orientation shift, and there's not enough staff. So you're asked to take a team of patients on your own. It's a few shifts earlier than expected. You're nervous, but you've got this. You're finally practicing as a registered nurse. Shift after shift, you show up to an increasing staffing crisis and increasing patient loads. 5 patients to yourself, 6 patients to yourself, 7 patients. This story reflects the realities of my first year of nursing. Entering healthcare in a pandemic was not the start to a nursing career that I envisioned. My name is Alex. I'm a registered nurse. I've been nursing for 3 years and currently work as a patient care coordinator. I'm hoping to shed light on a problem we are facing today in healthcare, a post-pandemic healthcare system that is treading on thin ice. And I want to be clear, this is not a BC-specific crisis. I have former classmates practicing across the country with shared experiences. This is a global problem. Acute care systems are pressured, our population is aging, and our workforce is decreasing. There are solutions being introduced to increase our workforce. However, this is just a starting point. The problem is much bigger than a shortage of frontline staff. We are stuck in an environment where there are shifts you feel your head is just above water, an environment where the term burnout is now common vocabulary. My hope for healthcare is a culture change, a big, bulky dressing that stretches far beyond Band-Aid solutions, a culture that not only supports patient care, but also the staff that are dedicated to the patients and profession. We need to create a culture so strong that people are lining up to work in healthcare. There are 2 benefits to investing in culture. First, it will attract new nurses, inspiring the next generation of nurses to follow their calling to care. And second, it will retain current nurses. So let's meet some nurses who are practicing in BC, examples of inspiring nursing careers. Meet Sherry. Sherry's been a nurse for 28 years. She brings a vast amount of experience to the team, having worked in medical and surgical nursing for the majority of her career. She's cared for hundreds, if not thousands of patients, and she's been there for patients and families during their best days and some of their worst days. Meet Jackie. Jackie's been a nurse for 23 years come this spring. She is the charge nurse overseeing the care of 40 patients on an acute trauma unit. She leads a care team of 11 nurses every day. She's a strong mentor for new staff, and she advocates for staff, patients, and families day in and day out. This is Laura. Laura's been nursing for 18 years. She currently works as a clinical educator where she leads orientation for new graduates and new hires each month. And she's just a phone call away for staff on the floor. She's a hands-on educator, making sure that our teams are caring for patients with best practice standards. And lastly, this is Brooke. Brooke has been nursing for 15 years. She's most often found in daycare surgery where she welcomes nervous preoperative patients to their care journey. She's a beacon of light on the floors, and now in her newest role as a clinical instructor, she's educating the next generation of health care aides. Although I am inspired by nursing careers like Sherry's, Laurie's, Jackie's, and Brooke's, I stand here, and it's very hard to picture my own frontline nursing career lasting over 20 years. Instead of talking about retirement plans, my classmates, the Gen Z nurses, are planning our exit strategies. When I talk to experienced nurses, they always reference the good old days, a pre-pandemic world of healthcare that sounds too good to be true, but a healthcare system that I want to be a part of. And so my hope for healthcare is to return to a system like the good old days, a system that I see myself carrying out a fulfilling career. My hope for healthcare is to return to a culture of caring. When we are called to the profession of nursing, we enter the profession wanting to care for a patient beyond a simple medical diagnosis. I hope for a system that truly embraces this specialized art of nursing. My hope for healthcare is for time bought back in our day. I hope for time to focus on patient care, for systems and technology that work for us, not against us, for processes that increase efficiency to buy back time, not to produce more, but to care more. My hope for healthcare is for balance. It is impossible to care for others if you cannot care for yourself. I hope that work-life balance feels attainable, that burnout and exhaustion is met with effective and supportive resources, that a nurse can feel energized after leaving work from a 12-hour shift. My hope for healthcare is to return to a focus on quality patient care over quantity of care, a system less pressured, where patient experiences don't feel pressured by the need for another bed, where nurses are proud of the work that they can accomplish in a 12-hour shift. My hope for healthcare is for innovative ideas to be driven by frontline staff. I hope for nurses to have the energy and the opportunities to have a seat at the table, for nurses to feel like they can truly make a difference for their colleagues and their patients beyond just providing bedside care. There is a saying, once a nurse, always a nurse. And so my final hope for healthcare is for career longevity, where stories like Jackie's and Sherry's and Laura's and Brooke's don't seem far-fetched, where nurses are proud of their careers, where the nurses of today see themselves in the future of healthcare.